I want to talk about a different type of of lupus. It's called drug-induced lupus. This is pretty common. We see this in clinical practice, and they may ask us a question or two because it's a disease that we're probably going to see in clinical practice. So it's most commonly associated, drug-induced lupus is most commonly associated with, it's 4 medications that are most commonly associated with this, and then there's another 150 medications that there's some associations with, but these are 4 that they could only ask us. So the main culprits are hydralazine, isoniazid, procainamide, and quinidine. So those are the main 4, and I say it again, if you look in the textbooks, you'll find another 150 drugs that are supposed to have caused drug-induced lupus, but these are the main ones. Drug-induced lupus is limited. It's a limited form of lupus. You get arthritis and fever, but usually you don't get any systemic manifestations. I mean by visceral organ involvement, lung involvement, heart involvement, nothing except the arthritis and fever. It's usually not confused with drug-induced lupus for this reason, because drug-induced, it's not confused with, systemic lupus is not confused with drug-induced lupus, because these patients usually have systemic manifestations. So this thing here, right over here, means usually not confused. I mean systemic lupus erythematosus is not confused with drug-induced lupus. The reason is because those patients have significant visceral organ involvement, kidney involvement, lung, and stuff like that. Patients with drug-induced lupus don't. So they only get the arthritis and the fever. The antibodies to look for are the anti-histone antibodies. The anti-histone antibodies are confirmatory. Now they may ask us a question, can you have drug-induced lupus? This is a good question for medicine boards. Can you have drug-induced lupus without anti-histone antibodies? And the answer is yes. It is very common for quinidine and hydralazine to often have anti-nuclear antibody negative lupus, and the antihistone is negative. So think about that. You don't have to have antihistone antibodies. Really, the diagnosis is made by stopping the medication that you think is the culprit, and then after about 1 to 2 weeks, right, the lupus basically goes away. If it doesn't go away, this is not drug-induced lupus. This is something else, or it's systemic lupus. You don't get any after effects, organ effects with drug-induced lupus, so you shouldn't be checking, kidney, for kidney failure 6 months later. Nothing happens to this patient once the medication is stopped, as long as you have drug-induced lupus. They may ask us a question about that because it's a common entity.